I'm Karen Patel. I'm one of the doctors at the Agora. I've been here now for 7 years, just over. Prior to this, I qualified over 30 years ago. I was actually a GP in Worthing for 20 years, a GP principal, and I always had a bit of an interest in fertility. My role at the Agora is I'm one of the consultants here, so I see patients for consultations, perform all the procedures, egg collections, embryo transfers. I like all of it, to be honest. I really enjoy the procedures because that's what was missing in general practice. Although I was one of the fertility GPs, you would do the consultations, but then you would refer the patients on, and that was it. You didn't really get to know what went on. But now to sort of put an embryo in, to transfer an embryo, and then patients come back the following year with their baby, I mean, that's just amazing. So that's really a big part of the reward, I think, and I really just love being part of that.
So my name's Laura, I'm one of the nurses at the Agora Clinic. I'm in charge of the egg donation and surrogacy programme, so it's always really nice to sort of teach the junior members on sort of those aspects.
So my name's Jen and I'm one of the fertility nurses at the Agora Clinic. So at the moment you mainly see me in recovery, before your egg collection and after. You might also see me in your second nurse consultations where I will go through all your injections with you.
So my name is Aoife McLaughlin. I'm a healthcare assistant here at the Agora. I do multiple jobs here. I do consultations with some of our clients where we go through injections, we go through dates, consent, any questions that they have, which is really nice for me because I get to see them from the start of their treatment kind of right through to when they have their transfer.
Hi, I'm Georgia. I'm a nurse administrator at the Agora Clinic. I'm actually doing a gap year, so I'm here on a placement for 1 year, myself and Cam. I switch between the admin team and the nursing team.
Hi, my name's Sam. I'm one of the fertility nurse specialists here at the Agora. You're likely to come across me in recovery or at initial nurse consultation, second nurse consultation, or for treatments. So my experience in gynaecology and women's health has really put a big emphasis on my job role here. I'm able to bring forward my knowledge and my understanding of female health, women's health, and really promote that in a way and be able to see things from all angles and just be able to empathise and understand the journeys that patients will have here. And actually, if anything does happen, I have some awareness and knowledge of how we can move forward or support that is available out there.
I'm Caroline, I'm one of the sonographers here and I do ultrasound scans for the patients at the Agora Clinic. I really enjoy it. I like seeing the variety of people that come through, having a chat and helping them along their journey through the different treatments that we do here. Some patients that come through can be quite anxious or nervous, and I'm the first person that they see, so I like to meet them and reassure them, tell them what we're going to do, and hopefully they come out feeling much better.
I suppose I've always had an interest in fertility because, you know, we didn't conceive easily either, and I've been through IVF myself. At the time I was a full-time GP, everyone around me was getting pregnant and it just is really hard to watch this. So I actually went through the process myself. We had to travel a long way at the time. It's very disruptive on work, but not many people knew, and we were really lucky that it worked first time. But then we went back for my second child and had 3 attempts, and actually they all failed. So I get it from both sides. I remember that sort of shock when I had a positive pregnancy test, middle of December, I think. I got the flu or whatever. But yeah, I just remember that and how happy we were, you know, when that pregnancy progressed. But then 2 years later to go through the stress and the heartbreak of actually having three failed cycles was, in a 12-month period of time, that was hard. And I really get how, you know, it really is hard for patients to deal with it. And, you know, having already got a first child, particularly I think I see patients that come back to try for another one, I get how they are they're desperate again to have another child, and you think, well, why? Because, you know, you've got no children, fair enough, but when you've actually got a child, why are you feeling like this again? And I've been through that, so I know exactly how that felt. So I do sort of feel like I can sort of empathise with the patients a lot, and although I don't I don't tell everybody, but I do share sometimes with my patients that I've done it, and we're out the inside. My kids now, I've got 2 children, 20 and 24. They're up here, way above me. So I've sort of come through it. And I think the thing is that although you may be really down and depressed when you're doing this, for a lot of patients, there's going to be light at the end of the tunnel. And you'll come out of it.
So my name is Michelle. I'm the COVID-19 Operations Manager and Communications Lead. I base myself in the nursing team, and so I see patients every day, which I absolutely love. You will see me in recovery. Sometimes I'll be taking your blood, which I know people hate, and often just talking to patients over the phone or through our salve messages. My job role here is to make sure that everything runs really smoothly. So particularly with the emergence of COVID, my role was to make sure that we could restart patients after we had lockdown, make sure that people could come through quickly but also safely as well. So we created a policy to be able to manage that and ensure that patients were able to come through as soon as possible. And thankfully we did get through that backlog of patients who had to be put on hold quite quickly. And we're just carrying on running really smoothly and safely, and ensuring that everyone is staying safe as well.
Everything changed in March with the arrival of COVID, and I know that Carolyn wanted for a year or two to look at us doing remote consultations for patients that are further afield or even abroad sometimes. I'm not one to look at myself on a screen, so I really was a bit apprehensive, but COVID changed it all. We had no choice. And we've all had to learn how to cope with Zoom consultations in the last sort of 7-8 months now. I'm getting used to it. I tend to find that I probably lean too close to the screen, try and sort of be close to the patients. But and sometimes it's hard. I'm fine usually, but it is hard when you're trying to deliver bad news because you're not there with them, so you haven't really got that sort of, that empathy and sort of trying to help them or trying to encourage them. But on the whole, yeah, I'm okay with them now.
So before I started at the Agora, I was actually in the local hospital here as a gynaecology ward sister and had been for many years. So when the COVID pandemic hit, we had to prepare quite well for it. So I was a bit apprehensive about coming to a small clinic and how the clinic had set up for COVID. But since coming here, seeing what's been put in place, how Zoom has come in, which I was apprehensive at first, doing nurse consultations over the telephone or even in Zoom, but actually it's proven to be a fantastic use of people's time. We're seeing more people are able to be more comfortable at home and in their own environment. And we are very COVID aware here with strict policies and procedures in place.
So COVID has been challenging in terms of having a mask and not being able to see people's faces. So I think it's really important that we have a nice chat before we do the scan and connect in that way, make sure people feel at ease, know who I am, know what I'm going to do, and explain things fully.
Lots more PPE, lots of, I suppose, distancing. Took a while to get used to wearing a mask and wearing goggles and getting fogged up, but I think you get used to it after a while.
So with the emergence of COVID, I found that there were a lot of changes that need to be made. Obviously there's the annoyingness of having to wear a mask, but that's okay, we're managing, trundling through that as well, the use of PPE. In terms of how things have really changed though, just not having as many patients in the clinic at any one time is kind of the biggest thing that I've noticed. Before COVID, the patients used to be coming in for every appointment that we had, but actually we've been able to make a lot of things a lot more automated in terms of just running things a lot smoother. So we've been able to make people do their blood tests, for example, from the comfort of their own home. All of the sort of consultations that we do as well, people can remote log in as well. So people aren't having to come in for every single one of those appointments. We even included home sperm test kits, so we didn't have to have patients having to come into the clinic and produce a sample here, which is rubbish anyway. So being able to do the test from home and actually get an instant result was really good. It just made things more efficient for that first process, being able to come in. People were able to get all of their tests done and then book in for their doctor's consultation, which was all done via Zoom, which just made things, you know, really easy for them. So sometimes we'd have a couple where one might be at home and the other one might actually be working in an office, but they were both able to take the time out and both log into the Zoom consultation.
It's hard with coronavirus around because, of course, I think the patients rely so much on their family and their partners, and having these new restrictions in place, they aren't able to come to the appointments, and sometimes the partners feel left out as they aren't able to come in with every appointment, tracking the journey with them. However, we have allowed them to come in for embryo transfers and early pregnancy scans, which I think is really good for them.